So the point of maximal impulse can be located at letter A, mitral valve area. Letter B, 4, intercostal space right mid-clavicular line. Fifth, letter C, 5th intercostal space left mid-sternal line. Letter D, Erb's point. Saan doon?
A po.
Okay.
Mitral.
Mitral valve area. So abnormal palpatory findings in the precordium would include, meron na naman except, abnormal palpatory findings in the precordium would include except lifts or heaves, thrills, palpable pulsation over the pulmonic area, palpable pulsations at the mitral area. Ano na exception? Except
B, Doc?
Heave po.
abnormal palpatory eh. Diba napapalpate mo ang heaves, diba? Napapalpate mo ang thrills. Okay? May palpable ba pulsations sa the mitral area? Wherein that is the point of maximal impulse, diba? Kaya nafe-feel mo doon, diba? Kaya kung tinitingnan mo yung yung chest ng pasyente, tingnan mo doon sa point of maximal impulse, diba? Parang gumagalaw yung heartbeat niya. So ano na exception doon? Lifts or heaves, thrills, palpable pulsation over the pulmonic area, or palpable pulsations at the mitral area.
C po.
Okay, letter C. Okay. Heart murmurs are caused by closure of the heart valves, opening of the heart valves, both, neither. Palagi natin sinasabi yan. Heart sounds are caused by, is it closure
Closure of the heart.
Okay, so remember that the heart sounds are caused by the closure of the heart valves. Okay? So anong ginagamit mo dyan sa stethoscope mo to listen to high-pitched sounds or low-pitched sounds? So the diaphragm of the stethoscope is used to listen to high-pitched sounds or low-pitched sounds, or both, or neither.
High pitch, Doc?
High pitch po.
Okay, high-pitched sound. Now, the first heart sound, the S1, occurs during the closure of the mitral and tricuspid valve, opening of the mitral and tricuspid valve, closure of the aortic and pulmonic valve, opening of the aortic and pulmonic valve. Ano?
Mitral
Closure
and
of the mitral and tricuspid
A, Doc.
po.
Closure of the mitral and tricuspid valve. Now, what are bruit? Bruit are normal sounds similar to murmur. Sounds indicate a partially blocked artery or overextended artery. C, can be heard in the precordium. D, all of the above. Are bruit normal sounds ba? Similar to murmur? Normal ba yun?
po, Doc?
Normal.
Abnormal sounds.
Abnormal.
Abnormal yun. Sounds indicate a partially blocked artery or overextended artery. Tama?
Yes, that's.
Yes po.
So,
Di ba yung sinabi natin, Bruy, yung mga either partially blocked or blocked, lumiit, or kaya naman lumobo ang artery. Pagkatapos pag dumaan ng blood doon, there is a swooshing sound, or gumaganon, parang ipo-ipo. So that is your Bruy. So you cannot hear your Bruy in the precordium because doon sa precordium mo, wala ka naman big blood vessels doon, di ba? So ang answer dun is letter
Letter
B.
B.
Some indicates partially blocked artery or overextended artery. A grade 3 murmur is a faint murmur, moderately loud murmur, very loud murmur, or extremely loud murmur. Grade 3.
Moderately.
Ilan ba ang ano? Okay. Moderately loud. Kasi ilan ba ang murmurs natin? Grade hanggang grade 6, di ba? Okay. Now, skin signs of a patient with peripheral vascular disease due to decreased blood flow. Okay. Thin toenails, thickened toenails, flash skin, or dull skin. Yung peripheral vascular disease mo, doon konti yung blood supply doon. So pag konti yung blood supply doon, flash ba, kulay red ba yung skin mo doon? Di ba? Hindi. Kasi ano siya, kulang siya ng dugo. Okay? You see the dull skin, thickened toenails, or thin toenails. So the answer there is
Thickened
thickened.
toenails.
Okay, thickened. Okay. A 3+ amplitude of the pulses means +3. Is it weak? Is it normal? Is it increased? Or is it bounding?
Increase po.
Increase. Where is the location of your pulmonary valve? Nasaan located ang pulmonary valve mo? Letter pulmonary, may letter L doon. Pag may letter L doon, ang ibig sabihin, is it right or left?
Left po.
Left. Anong space?
Second
Left intercostal.
Space. At saka, it is at the left edge of the sternum. So the location of the pulmonary valve is on the left edge of the sternum, second intercostal space. Left intercostal space. Now, what is a trill? A trill is, ano ang trill?
Palpable murmur.
Okay, a trill is a palpable murmur. Okay, so it is not a heave because a heave is a lift, di ba? And abnormally large beating of the heart when placing the palms of the left chest. Ano yon? That is a heave. A sign of left ventricular hypertrophy, that is a heave. Okay? Pag sinabi ng trill, it is only a palpable murmur. Okay? So what is paradoxical breathing? So paradoxical breathing, abdominal wall may move inward during expiration, seen in cases of diaphragmatic paralysis. Letter C, both. Letter D, neither. Paradoxical breathing. So, yung paradoxical breathing mo, it means if you have a paralyzed diaphragm, ano nangyayari sa ano mo? Abdominal wall mo during breathing. So ganito yan. So if you have diaphragm, normally if during inspiration nag-inspire ka, ano nangyayari sa diaphragm mo? Does it go up or it goes down? Nag-inhale ka.
Goes
Down.
It goes down, di ba? Kasi napuno lang yan ng hangin yung lungs mo. So, pag napuno yan, the tendency is your diaphragm will go down. Okay? So, in paradoxical breathing, in cases where you breathe in, meron kang diaphragmatic paralysis. Ano nangyayari?
It goes up po, Doc.
It goes up, hindi parang magkasalungat. It goes up, it does not go down. Okay, that is paradoxical. Okay. Barrel chest mo may be due to A, congenital deformity, B, associated with emphysema. C, lung hyperinflation. B and C only. E, all of the above. Barrel chest.
BNC, Doc. C.
BNC Doc.
B and C? Bakit? Di ba? Meron din kayo nakikitang barrel chest na ano, pinanganak sila yung pigeon chest, yung gumaganon, di ba? So it could be a congenital deformity. Kagaya nung kampanerang Cuba, sinasabi nila na congenital deformity dun yun. Pero meron din tayong mga chest na pigeon chest, barrel chest, na pinanganak sila doon. So it could be secondary to congenital deformity din, associated with emphysema, lung hyperinflation. So anong sagot?
All of the
Dog.
All of the above.
All of the above. In lung consolidation, tactile frematus is it pronounced or diminished? Tactile frematus.
Diminished.
Decrease po.
Tactile frematus, lung consolidation. Consolidated na naman. Basta pag sinabi mong consolidation, may ano yan, parang nagiging solid mass yan. Kasi meron ng mga plema na namuo doon, may mga debris, may mga pus na namuo doon, so tumitigas siya. So ano nangyayari sa tactile frematus mo?
Increase po pala, Doc.
Increase po daw. More pronounced po.
It is pronounced. Kung halimbawa presence of pleural fluid,
Decrease.
Decrease naman pag presence of fluid. Okay? Kasi magdi-decrease yan kasi wala ka naman na percus doon kasi tubig yun. Okay? So a flat percussion tone is noted over bone structure, well-developed muscle tissue, C, both, D, neither.
Both.
Okay, both. Both. Okay, matigas yung bone mo, matigas din yung muscle tissue mo pag well-developed, di ba? Increased vowel sounds can be heard on the following conditions. O saan mo na-increase ang vowel sounds? Is it in diarrhea, late bowel obstruction, peritonitis, paralytic ileus? Ano dun sa apat? Increased vowel sounds.
Diarrhea po.
Okay, diarrhea. Okay, diarrhea. Okay, kasi sa late bowel sounds, late bowel obstruction mo, wala na. Wala ka na maririnig. Okay, late na eh. Peritonitis during infection of the peritoneum. Wala kang maririnig doon. Or paralytic ileus. Paralytic ileus, hindi gumagalaw yung mga intestines mo. Hindi sila gumagalaw, parang paralyzed sila. So you call that your paralytic ileus. So decrease ang vowel sound mo or even absent vowel sound. So decreased vowel sounds can be heard in the following condition naman. Decrease ngayon diarrhea, early bowel obstruction, letter C, post-abdominal surgery, letter D, gastroenteritis.
C po.
Okay.
Post-abdominal.
Post-abdominal surgery, di ba? Kung may experience kayo ng mga kamag-anak na nagkaroon ng abdominal surgery, di ba? Anong palagi nilang hinihintay? Palagi nila hinihintay yung pag-utot ng pasyente, di ba? The passing out of gas. Kasi it means that meron ka ng gumagana na yung bowels mo. Okay? So you can already have your bowel sounds. So kasi nadi-decrease yan or even absent after abdominal surgery. Brewing can be heard in abdominal auscultation. True or false? Ba't ang tagal yung sumagot? Brewing can be heard. Brewing can be heard in abdominal auscultation. True or false?
True, Doc.
True po.
True. Kasi abdominal, nandiyan yung abdominal aorta mo, di ba? So naririnig mo doon yung bruit. Kung halimbawa may aortic aneurysm ka. Di ba? Okay, so bruit can be heard in abdominal auscultation. True or false?
True, Doc.
True.
True. Normal vowel sounds in percussion would be, anong normal vowel sounds in percussion? Tympani, increased tympani caused by fluid, decreased dullness in the presence of fluid or mass, A and B only, A and C only. Normal vowel sounds in percussion would be
Doc, ano po ulit yung ABC?
normal vowel sounds in percussion would be letter A, tympani. You have this decreased tympani caused by fluid, decreased dullness in the presence of fluid. A, B, or C?
A po.
Okay, A, normal nga eh. Tingnan mo kasi you try to analyze the question, meron na nga doon normal vowel sounds eh. Pagkatapos si letter B, increased tympani caused by fluid, decreased. And yung pinaka-main sentence niyan is normal vowel sounds in percussion. So anong sagot?
Timpani.
Timpani.
Tympani. Okay? Abnormal palpatory findings in abdominal exam would include abnormal palpatory findings in abdominal exam would include voluntary muscle rigidity, spasms, both, neither. A, B, C, or D. A, voluntary muscle spasm, rigidity, voluntary muscle rigidity. B, spasms. C, both, D, neither.
Both.
B, Doc.
B, spasms. Kasi yung voluntary muscle rigidity mo, yung pasyente, siya pinapatigasan niya yung tiyan niya kasi voluntarily na pinapatigas niya yung tiyan niya, kaya nagiging rigid. Pero kung halimbawa, nakikita mo yung mga spasms, okay, or involuntary muscle spasms, then that could be an abnormal palpatory findings. So, what is the answer? Abnormal palpatory spasm.
Exam.
Common abdominal variations naman ito in older patients. Common abdominal variations in older adults. A, increased bowel sounds. B, decreased abdominal tone. C, liver border not palpable easily. A and B only.
B po.
B. Okay, decreased abdominal tone. In the examination of a patient's hand, look for the presence of, except koilonychia, leukopenia, nail clubbing, dupuytren's contracture. A, B, C, or D? Intindihin niyo mabuti. The examination of the hand, look for the presence of, except koilonychia, leukopenia, nail clubbing, dupuytren's contracture. Nag-ano natin yan, ni-lecture natin yan, except ano?
Leukopenia.
Okay, except leukopenia. Ano bang ibig sabihin ng leukopenia? Decrease leukocyte count mo. O, di ba? Yung koilonychia, nail clubbing, dupuytren's contracture, lahat yun makikita mo sa hands ng tao, di ba? Nakikita mo ba yung leukopenia sa hand ng pasyente mo?
Hindi po, Doc.
Leukopenia
No po.
is a laboratory finding. Porque pare-pareho lang sila ng ng sound ang hirap-hirap niyong sagutin. So shifting dullness is a sign of ascites, hepatomegaly, both neither. Ascites yan hepatomegaly, both neither. Shifting dullness. Ano ba? We have discussed shifting dullness, di ba? Pinakita din yan sa doon sa audiovisual presentation. Shifting dullness is a sign of
Ascites.
okay, ascites. Okay. Expansible abdominal aorta on palpation could be suggestive of expansil. Abdominal aorta on palpation could be suggestive of abdominal aneurysm, abdominal stenosis, both neither. Expansile, lumaki. Easy. Easy, Andre,
Dok,
Aneurysm?
ulit po yung Yoises po.
Expansile, abdominal aorta on palpation could be suggestive of aneurysm or stenosis.
Aneurysm.
O may naririnig kong aneurysm, may naririnig kong stenosis. Expansile. Ano expansile?
Aneurysm, Doc.
Nag-expand po.
Aneurysm po.
Aneurysm.
First level.
The following tests are used in the assessment of peripheral circulation. Assessment of peripheral circulation except Allen's test, Berger's test, capillary refill, Weber's test.
Weber's.
Okay, Weber. Kasi saan ang Weber's test? Ginagamit yan sa test for hearing, di ba? Nakakalimutan nyo na naman. Okay, ito. Nagtataka ako dito sa inyo. Ang dami-daming mali dito sa number 51 na ito. A comprehensive health history is letter A, compressed history. Letter B, problem-oriented interview. Letter C, both. Letter D, neither. O Pauline Ruth. Ilak. Miss Ilak, ano yon?
Doc, ano po ulit yung question?
A comprehensive health history is a compressed history, problem-oriented interview, both neither.
B po, Doc.
Sino are there any other answers?
Neither, Doc.
Neither.
Neither, Doc.
Ay,
Physical examination.
A, B, C, or D?
D, Doc.
D, Doc.
Neither.
Physical examination.
Sabi sa inyong kasi di ba ang comprehensive health history, when you see your patient for the first time, complete yung history na gagawin nyo, di ba? You include everything. Ano yung ini-include mo? Yung identifying data, chief complaint, history of present illness, review of system, lahat-lahat na yon, di ba? Gagawin mo. Pero if you already know the case of your patient, gagawa ka ba ng comprehensive?
No,
Hindi
focus
ba?
na.
focus na po.
Your focus history or problem-oriented history or kinaliit mo na yung history mo and that is your compressed history. Ang daming hindi nakakuha sa inyo. Compressed, di ba? Pinaliit mo na yung history mo. You only already focus on one organ system. And that is depending on the disease of the patient. Kung COPD, hindi magko-concentrate ka na lang sa respiratory system because you already know the previous history of your patient. So, nagiging compressed na yung history niya, dumiit na. Kasi nandun ka na lang sa focus and your problem-oriented interview. Dali-dali nun, dami pa sa inyong mali. Ito, ang dami-dami na naman mali dito sa inyo. The scope of health history would include except patient's concern, physical examination, goals of assessment, clinical setting. Anong exception doon? Anong exception doon? The scope of health history would include except letter A, patient's concerns, B, physical examination, C, goals of assessment, D, clinical setting. Ano?
Physical examination.
Physical
Clinical
examination.
set.
Physical, anong sagot mo? A, B, C, or D? Ha?
B po.
Okay, B as in boy, B.
Boy, physical.
Kasi physical
Physical.
examination, ano ba yung health history mo? Ano ba yung health history mo? It would include yung anong concerns ng pasyente mo, o ano yung goal mo ng assessment regarding your history, o ano yung clinical setting mo, saan mo ginagawa yon, history mo. Di ba? Except yung physical examination because that is not a part of your history. O, nakaintindihan tayo doon. Your physical examination, your clinical setting is dependent on saan mo ginagawa yung ano mo, history taking mo, or saan mo ginagawa sa OPD, sa hospital, sa room ng pasyente mo. That is your clinical setting. Documentation of the absence of a specific illness is documentation of absence. Pertinent, negative, or pertinent positive?
Pertinent negative po.
Bilisan yung sumagot. Dali-dali ng mga tanong. Education level can be a part of A, personal history, social history, both, neither. Educational level,
Both.
both. A symptom is A, subjective data, B, what you observe in the patient, C, objective data, D, what you detect during physical examination. Symptom,
Subjective
A,
data.
data.
A, subjective data.
subjective. Reliability, ito din, ang daming mali sa inyo. Reliability during patient's interview would be made at beginning of the interview, end of the interview. Both, neither.
End po.
End of the interview.
Interview.
At the end of the interview, paano mo ma-assess yung reliability ng pasyente mo kung hindi mo pa siya nakakausap? So after you have ended your history taking, then that is where you would now rate the reliability of the patient's of your assessment of the patient's history. Okay? A chief complaint may be recorded as my head aches. I came for my annual checkup. C, both, D, neither.
Both.
Both.
Both. Tobacco, alcohol, drug use may be recorded in personal and social history, history of present illness, both, neither.
Both.
Both.
Ay, both.
Both. A patient who smokes 3.5 packs per day is recorded as 35 pack year, 3.5 pack year, 30 pack year, 3 pack year. A patient who smokes 3.5 packs per day.
35
Ano?
pack.
Ha? Ilan? 35, 3.5, 30, or 3?
3.5.
3.5.
Okay, 3.5. Kasi for every year, 1 pack. Okay, 3 years yan. First year, 1 pack. Second year, 1 pack. Third year, 3 pack. May 1/2. O di yung 1/2 is 0.5. So 3.5 pack year. Inability of a patient to cooperate to the historian may be due to language difficulties, influence of medication, fear, A and B, A, B, and C.
A, B, and C.
A, B, and C.
Gestational age of a newborn can be computed by Dubowitz method, Ballard's score method, C, Bode, D, neither. Na-mention ko yan sa lecture natin. Gestational age of the newborn. Dubowitz, A, Ballard's, B, Bode, C, D, neither. Dalian nyo at marami
Ballard.
pa. Ha?
Ballard score.
Ha?
Ballard score, Doc.
Okay, it could also be both, okay? Mas popular kasi ang Ballards, kaya alam niyo yung Ballards. Pero it could be also you use your Dubowitz method. So both. Apgar scoring is taken how many minutes after delivery? 1, 5, both, neither. Apgar score, di ba? Discuss natin yan.
Both.
Okay, both. Okay, so your Apgar score can be taken at 1 minute after birth, 5 minutes after birth, and even 10 minutes after birth. And nakalagay lang dito 1 and 5, so both. Pediatric history taking would include milk feeding, either breast milk or cow's milk, solid foods, fluoride use, D, A, and B only, C, all of the above.
All of.
Okay, all of the above. Okay? Kasi titingnan mo din ang fluoride use. Kasi kung minsan kung nagtututbrush na yung bata. Okay? Kasi kung minsan, there would, it could be a part of your feeding history, the dental condition of your patients. Okay? Concurrent findings with angina pectoris would include, what do you mean by angina pectoris? Ano ibig sabihin ng angina
Chest
pectoris?
pain.
Chest pain. Okay. So what would be the concurrent findings with angina pectoris? Letter A, physical activity stress. Letter B, windy weather. Letter C, both. Letter D, neither.
Both po.
Okay, both. Okay? Nandiyan yan sa lecture natin. Signs and symptoms of angina pectoris, except, may exception ito, signs and symptoms of angina pectoris except squeezing, feeling in the chest for 30 minutes, radiation of pain to the jaw, shortness of breath, indigestion.
Indigestion po.
A po.
Okay. The answer is letter A. Kasi dito sa angina pectoris mo, di ba, kung minsan nakakaroon ka ng chest pain, sinasabi mo, masakit itong sikmura ko, sinasabi natin, pwede, it could be a heartburn, di ba? Galing ito sa sikmura mo, kasi it could be secondary to hyperacidity. Pero, that would involve also irrigation to the chest. Kaya, pwedeng indigestion. Pero, the best answer is squeezing feeling in the chest for 30 minutes. Masyadong matagal na yun. Matagal na yun. So, if it is more than 30 minutes, you would now think of the signs and symptoms of your acute myocardial infarction. Okay. So, What are the signs and symptoms of your acute myocardial infarction except ito pain occur even at rest. Okay, nitroglycerin would relieve the pain. Letter C, signs of shock. Letter D, difficulty of breathing.
B po.
B po.
D, nitroglycerin would relieve the pain. Itong nitroglycerin nyo, ito yung maliliit na tableta na nilalagay underneath your tongue in order to dilate your coronaries. Eh kung naglagay ka na doon na wala pa ring epekto, that means in a serious condition ka na, you can go anytime because of acute myocardial infarction. Congestive heart failure. Okay? Failure of the heart to pump blood adequately to maintain tissue perfusion may be due to COPD. Both, neither.
Both po.
Okay, so in congestive heart failure, failure of the heart to pump blood adequately to maintain tissue perfusion, okay, may be due to COPD, so it's both. What are the common signs of AURI? Ito, signs ito. What are the common symptoms muna of AURI? Except coughing, sore throat, congested oropharynx, headache. Common symptoms. Except letter A, coughing, letter B, sore throat, congested oropharynx, headache.
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 Ay, naku. Is headache a symptom? Headache ba symptom? Subjective sign? Pag sinabi ko, masakit kasi ang ulo ko. Ano malay ko, nasakit-sakitan lang yung ulo mo kasi ayaw mong pumasok. Is that a symptom? Headache. What the patient feels?
Yes, Doc.
Or is it a symptom? Bakit except? Sore throat, coughing, are